Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler. Today, we are going to talk all about plastic surgery recovery. And I have a beautiful group of young women with me from Radiant Recovery and Wellness. So they are an amazing brand. And with me are Deanna and Marissa. They met, I'm going to go over a quick bio so you guys know all about them, but they met during their years of nursing school at Sacred Heart University. They bonded because they were hustlers, they had that hustle hard mindset, and they worked together in several jobs in college. Years later, after they both established their careers as successful RNs, Deanna and Marissa found each other once again. So as a mom of four, which is wild to me, Deanna had started marketing herself as a private duty nurse company caring for patients after plastic surgery, and Marissa, with her background in plastic surgery, supported the new venture. As time went on, what was supposed to be a side job for Deanna had started to flourish into something much more than that. And basically they knew that this wasn't going to be something that could be done with like a one-woman show. So they worked together and formed what is now Radiant Recovery and Wellness. So they work together. They have very similar values, which include providing compassionate luxury care to their clients. And that makes the partnership bulletproof. So at just 28 and 26 years old, which is young AF, Deanna and Marissa are living their dreams as entrepreneurs and will always seek ways to make Radiant the best in the industry. So welcome, ladies.
Thank you.
Thank you.
So nice to hear.
Yeah.
Isn't it great? I love reading people's bios. It's like, you need to hear how amazing you are.
Yeah. Thank you for that. And just for meeting with us. This is awesome.
Of course. Okay. So just so the listeners who aren't watching can know, okay, Deanna, you just say hi and say your name.
Hi, I'm Deanna.
Okay. And then Marissa.
I
feel like occasionally some of my guests sound exactly like me. And then it's like, who's talking? I don't know. But I think they'll get it today.
Yeah.
Good.
Okay, so I'm going to jump in with a list of questions that I prepared for these ladies because I want our listeners today to just have all the facts, know where these girls came from, know what they're doing, and just be, informed, educated, potentially use their services and be inspired. So tell me, girls, and you can talk individually or you can kind of like one at a time, whatever feels good for you guys, but what got you interested in plastic surgery recovery?
Well, we both grew up in plastic surgery. My mom was a surgical tech for a plastic surgeon all my life. So I remember at like 10 years old, seeing surgery and just seeing the process, making little recovery bags in the office. So I grew up with it. And I actually worked with my mom in college, and becoming a nurse per diem with her. So it's kind of just followed me, and same for Marissa.
Yeah. My uncle is world-renowned plastic surgeon, Richard Ben Simone. He's famously known for his chemical peels. I was so lucky when I was in college to intern at his surgery center in Portland, Oregon, and first assist and scrub in and learn to circulate. And I got a lot of experience there in all types of procedures. And that's really where I fell in love with plastic surgery. I will admit, I was one of those people that had a little bit of a negative stigma when I was younger. And then once I got into the world, I saw how much it changes people's lives.
I know it seems so superficial and, because it is elective, it can seem unnecessary to people who maybe don't understand or haven't been through a cosmetic or even a reconstructive journey. But what we do really does change lives.
Oh, yeah.
100%.
I had my first breast augmentation, I had it at 16 years old. And it was because, I was very heavy as like a little girl and then developed. And my mom's like, you know what, I know that you would feel better if you did this. And so that's where like, we know it changes people's lives because it changed mine individually at such a young age. And nobody even knew, it was just for me. And that's all that mattered. So yeah, it's been around, it kind of just fell into place pretty perfectly that this is what we're doing.
I love that because you guys kind of have the experience, not just once you started schooling, but kind of your whole life, which makes you, have a little bit more wisdom than somebody else at your same age, for example.
Yeah, for sure.
Yeah.
So what do you guys love the most about, helping patients after surgery?
I think that after surgery, a lot of people don't know what they've gotten themselves into, and they are like, "Oh yeah, I'm gonna have 360 lipo or a tummy tuck, and I'll be back in normal, and I'll be able to take care of my kids in a couple days." And they don't really realize how much of a journey, a recovery journey it is. And so that's where we step in. And I love that we're able to be there for them physically, emotionally, mentally. It is a big journey. So that's my favorite part about it.
Yeah, and just creating the relationships, one-on-one care, which is something that you don't get as a registered nurse in the hospital. It's like, okay, especially I was labor and delivery, so I knew my patients until they delivered, and then it was off. So just creating such deeper bonds with patients, I feel is what people go into nursing for anyway. And to have relationships that last because you're making such a difference for them emotionally too. It's great.
I love that. And I can totally, the comment you said about people don't necessarily know what they're getting into resonates with me specifically. Like when I had my rhinoplasty recently, which again, game changer, like really helped my confidence, all the things. And I wasn't necessarily someone lacking in confidence, but these little things we do make huge differences. But after my procedure, I actually had an allergic reaction. And I had that like, oh shit moment where it's like, what do I do? Like, everything is going wrong. Like, this isn't the way this is supposed to be. And I think had I had someone like you, I mean, obviously I'm a physician and this is what I do. And, my colleagues were there for me and it was totally fine. But if I were a patient who didn't know medicine and didn't know, what to expect, what to do when you are troubleshooting something, it would have been extremely beneficial to have somebody like you guys there by my side.
Yeah, and I'm sure you can speak on this from a plastic surgeon perspective, but we've had so many patients that are physicians, emergency room physicians, anesthesiologists, internal medicine physicians, and actually a lot of CRNAs. And even though these people are of such high medical expertise, when it comes to plastic surgery specifically, that's not their area of expertise. So that's when we step in and give them the knowledge that's missing.
Literally so true. It's like when people ask me, like I have friends ask me about like kid diseases and I'm like, listen, I am far removed from pediatrics. Like I have no freaking idea. I go to the pediatrician probably more than you do. So exactly. Okay. So what do you feel like is one of the barriers? Like why do people not call a nurse afterwards? Like what are the barriers to getting recovery services that you provide?
Well, there's so many ways to answer this question, but mainly I would say one, the surgeons are not, speaking of aftercare. And that could be because plastic surgery has changed and people are doing more now. So they require more medical attention after surgery, professional care. I would say that. And
Yeah, I think that when someone decides to do an elective procedure for themselves, they're saying, okay, I've set this budget aside and I'm going to spend already this much money on plastic surgery. And then sometimes you're spending money on supplies, massages, depending on what the surgeon recommends. And they're like, oh, I can do without the nurse. But it happens so often that we are called post-op when the patient after the surgery really needs us. And I have had a couple surgeons that we have reached out to say, I mean, I love what you guys do, but I don't want to tell my patients they need a nurse after surgery because that's going to scare them away from the surgery. And that's not our goal. I think if you have the right resource at home, you can recover with the help of a family member, but a lot of things entail and details like come after surgery where we need to step in and take over.
Yeah. And I think also, the way things are done today, like you alluded to, are different than before. So maybe people who were getting multiple procedures before used to stay overnight or even have their procedure done in a hospital. And now it's safe and it's typically almost like standard of care that we can do 1, 2, or even 3, depending on the length and the depth of the procedures in one day, and then the patient goes home because we want them comfortable. We know that it is safe. And it's in those instances where you're correct in that having somebody there would just kind of take the pressure off. It would give reassurance. It would give comfort. So at least letting people know that that's an option, I think, is important.
Yeah. Even people that are super independent, like a lot of moms, right? They think I'm good, I'm strong, like I can do this. And they need someone there to kind of relax them and be like, you need to take these initial few days to chill out. Yeah. Because you can't do it all. And it just ends up, those are the people who do too much too soon. They take a step back in their recovery. Their swelling lasts forever. So, for sure, just making sure someone can be there to monitor your activity alone.
I tell my people, like in the early stage, like you need to be a princess duty, like don't lift anything, don't do too much, don't get your, heart rate up getting angry at somebody in your household, like be a princess. And so I guess, part of what you guys do, aside from doing a lot of the medical stuff, is also kind of reassuring them mentally how to de-stress and be calm. Like how do you guys, put your influence in, and how do you change that recovery process for them?
Yeah. So as soon as somebody books with us, they do get a packet that talks about not only what their surgery is going to look like generally in terms of the physical recovery, but the mental, emotional part. I think that people don't realize in plastic surgery, you go and you get something augmented, something changed, and you're like, I'm going to look beautiful the next day. I'm so excited. But you have to understand that it's a process. Things are going to be swollen. Things may be asymmetrical. You may look in the mirror and think you made a mistake. Did I choose the wrong surgeon? Should I not have done this procedure? And we're really there to say, hey, this is all normal. You're going to have swelling. You're going to have bruising. It can last for anywhere for up to 3 to 6 months, depending on the procedure. And you won't even have your full results till a year. So I feel like we really relieve a lot of pressure off the surgeons, because patients are often calling the surgeon like, oh my goodness, I look like this. Is this normal? And we're there to say, yes, it is normal. Be patient. It's all going to work out.
That's so important. So how long do you have a protocol or a recommendation depending on the case? Like how long do you guys typically provide those recovery services for people? Is it 1 day, 2 days, 5 days? Are they able to contact you indefinitely? Like what's your regimen?
So we have consultations with everyone because everyone's situation looks different. If you have someone that's medical professional in your family, you might just need overnight care to get you through the next day and then give report to someone who, can actually do what you're doing. But it's so personalized. We have a lot of patients that fly from outside of the country, from across the country to New York. They're staying in hotels. Yeah. Some people don't want anyone to know what they're having done. So those are the people, sometimes we take care of them. Like right now we have someone for 10 days.
Yeah.
But others just need that initial 1 to 2 days or overnight care visits. So
it's customized essentially.
Our most common patient that we find that needs nursing care is the quote unquote mommy makeover. So an abdominoplasty with 360 lipo, and sometimes a breast augmentation is added in there. And those patients use anywhere from around 48 to 24 hours. Even 72 hours, because we're positioning them in the proper position, especially if they have a diastasis repair. We're helping them get in and out of bed. And over those 2 days, we're doing a lot of education with the patient and the family member that's going to be taking care of them and get them on a regimented pain schedule. If they have JP drains, that's another thing that we do a lot of education on. So
the circumferential body lifts too.
Yeah.
Those are getting more and more popular.
Yeah, because everybody's lost weight from Ozempic.
Yeah. It's great, but you need someone there to do a dressing change in your backside, or even just assess what's going on, because you can't, so patients too, it's just added discomfort just going to the back as well.
So what are this is just maybe education for me, but also for maybe people are going to have surgery, like what are some no-nos that you've seen maybe other caretakers do for patients, or like just like stuff that you're like, no, like don't go there. You may not have anything, but I just thought it'd be interesting if you did.
We trialed it in the beginning before Radiant was like even a company, and we had like CNAs or LPNs, and we love our CNAs and LPNs. Don't get us wrong. I think when they come into assistance, they're great. However, after a procedure, you can be prescribed oxycodone, Valium. So you're getting, a benzodiazepine and a narcotic, and we only want registered nurses that know about the medication, know about the half-life of the medication, how long it's taking to work, and they're not mixing some sort of cocktail of drugs that's going to delay your recovery. Also, if you're getting liposuction, which is a very common procedure, a lot of these patients are vasovagaling and passing out. You take off and that blood
and get in a
pressure
hot shower.
Exactly.
Yeah.
The whole point of having a nurse there is so that you don't have to go to the hospital, right? And so all of our nurses have critical care experience
Or
and
emergency.
we professionally train and onboard them. And as we've expanded to the other states, I have been so lucky enough to fly out there and meet all of these nurses in person, and onboard them, because we want to do also a vibe check, right?
Yeah.
There's a lot of nurses out there. And so anyone that we hire, we need to make sure that they are a super, super compassionate soul. And not everyone that's recovering is going to be the kindest patient. And we understand you're in your hardest days. And so we just need a nurse that's going to be kind no matter what and really support the patient
They have to
emotionally.
they have to check all the boxes.
Yeah,
sure.
That's so important. I mean, I've worked in places where I've seen people in the recovery room like yelling at people, like, and it's just like, no, you don't need to be like that. These people just went through surgery. Like, yeah, they're not going to remember that you yelled at them necessarily, but that's not the way you should treat people. So I totally get that people need to pass the vibe check and be kind and compassionate.
And we do have a business line that comes straight to both of our phones, where we let anyone that's booked nursing services with us call us at any hours of the day. If you're in the middle of the night and you're like, oh my goodness, like I took this med at what time? What should I take it again? We're there to support you through the whole entire thing.
That's amazing. That's really good. So I know you guys do as well some kind of like holistic and more natural care or techniques, or you recommend some things. Like, can you guys expand upon that and tell me what you like and don't like?
Well, for both of us, nutrition, we just see nutrition, anti-inflammatory diet really does make a huge difference. We even have a nurse. Her name is Julie. She has her own recovery juices business, and it's targeted towards all different forms of types of recovery, like digestion, immunity, like all the things that you need after surgery. But nutrition is so important.
Yeah, sort of doing like a prehab, we call it, before surgery, cutting out all inflammatory foods like, gluten and dairy. Those patients tend to heal the best. And taking supplements like arnica and bromelain, and as well as keeping your stress down is very important. I explain to patients, your mind is so much more powerful than you think it is. And if you are stressed out mentally and emotionally, you are going to have a slow recovery. So that is where we do, come in and relax the patient with our words.
Yeah.
I love that.
They reach out to the patient prior to going into surgery. So the patient alone knows, because a lot of times the nurses are meeting them for the first time when they wake up from surgery, and it could be a little awkward, they're about to be with you for the next 24 hours. So our nurses do call the patients like the day before surgery and just introduce themselves and answer those last minute questions. So they're starting off on a good note.
I love that. I think that's really important. And the prehab, I think, is really great and super important. I love, people ask me, oh, what should I do to get ready? And it's like, clean up your diet, make sure you're getting plenty of protein, make sure you're getting sleep, make sure you're hydrating, the stuff that you just tend to forget because you're just in a rush, trying to get ready, like arranging everything maybe with your kids or your job, but you have to also arrange your body too. You have to get ready.
Yeah, for sure.
So you mentioned arnica, you mentioned bromelain. Are there any other supplements or maybe naturopathic medications that you guys have found helpful, or even like regular medications that you feel like have been game changers or helped people that aren't like typically prescribed?
Yeah. So we do offer supply coordination to some of our patients that are more local. And we give them liposomal vitamin C
And
and
glutathione.
glutathione and a probiotic because of the antibiotics.
Yeah.
I think that the vitamin C and glutathione is a great mix, especially for those who had like the heat assisted liposuction, because they just need to be replenished
Yeah.
fast, you know.
Yeah, and we do let patients know, like, we love to suggest all these things, but don't feel pressure to get them because we understand that there's already so many things that are going into your surgery. But
Yeah.
if you want to have this to help you, you can
It's
get
there.
it. Yeah, it's there.
So the glutathione and the vitamin C, you guys do that IV, or do you recommend you?
Liposomal. It's a
Oh,
supplement.
okay. Gotcha.
Yeah, we use Symbiotica. We buy their liposomal packets and just give it to them.
Oh, I love that. That's great. Yeah, and speaking on the probiotic specifically, like with my reaction, I love to tell personal stories on my podcast, by the way. With my reaction, I had to take like antibiotics, I had to take steroids, I had to take antifungals, and I really felt like my system was just like shocked. Like it was totally reset. My gut balance was completely off. I was holding on to weight, even though I had no surgery. You know, I had an implant exchange too, but that's not major. And as soon as I kind of got back on a probiotic and programmed my gut, things got back to normal. And I think that's something that we forget. Like, oh yeah, you had antibiotics. Like you just cleaned out your entire microbiome. Let's reset it.
Yeah, absolutely. Absolutely.
Okay. So do you have okay, so we talked mostly about like before, what do you guys tell people like activity wise? Like, do you tell them to slow down like their exercise before surgery, after surgery? Like what do you guys talk to them about movement at all? And what are your recommendations usually? Obviously based on what they have done.
Based on what you had done, we let all of our nurses know at the end of the day, the post-op
Hold
instructions.
on. You guys, it paused. So just start over with the answer to that question. I think it was like a bad signal for just a second.
Can you hear us?
But now you're good. Yeah, now you're good.
We have our general protocol we teach our nurses, but then also what a surgeon wants we're going to do post-op, right? Because every surgeon's different based off the procedure. But speaking generally, we really encourage walking, but walking slow, right? Because that's going to prevent blood clots, prevent pneumonia, and increase blood flow to those areas of injury where you had the surgery. So we're big on slow walking. And we do partner with somebody that does post-op like yoga for moms once they get cleared after like a diastasis abdominoplasty to start post-op yoga via Zoom. We do that as well.
Oh, I love that. Via Zoom, that's perfect.
But even before the surgery, we encourage the walking and Pilates. Like, you want to be as strong as you can going into this. You don't need to be lifting 200 pounds the day before surgery. We have to be smart, but preparing your body in that way and making sure that you're strong, especially for the tummy tucks, because there's in a bent over position so long after surgery, the stronger you are, your leg strength.
The patients that work out every single day and they're like, I just had this extra skin, I have to get it off. Those are the ones that heal the fastest because they've already been taking such good care of their bodies. So we're like, keep working out, keep those legs strong. You're going to have to use them after recovery. So
I love that. Although I don't recommend working out the day of surgery. I've had patients do that. I'm like, oh my God, like you're dehydrated. You just like
drink or eat. Yeah, no.
It happens. And I'm like, okay, extra fluids for them. Okay. So I love everything that you guys have talked about. I feel like this is super on par with what I recommend and what I prescribe, but I want like you guys to be able to kind of advertise yourself. Like where can they find you? You're obviously in the city, you're in New York, but you guys have nurses in this area as well, in the Palm Beach County area. So like, how can people find you? Where else do you have nurses? Like give us the deets.
So we're in New York, Connecticut, New Jersey, West Palm, and also Tampa. And
both sides of Florida.
Yeah, both sides of Florida. We are in Texas, and we do have a team in Los Angeles as well. And we are growing in Washington, actually.
Washington and Massachusetts.
And Massachusetts. Oh goodness, I can't even
Do you
keep
have
track.
patients that will DM us on Instagram and they're like, I can't find your services in my state. And then how can I get you guys? And we're
And
like,
we
we're
make
going to
it
make it happen. We find that in the private duty nursing world in general, there's a lack of professionalism. And that's where we came in and we're like, okay, you're showing up for your shift. You're in a nice pair of scrubs that say Radiant Recovery. You look nice. The patient feels, comfortable going home with you, because so many patients have horror stories where they're like, I thought a scary nurse was going to show up that was going to be mean and go home with me. So that's really where we step in and bring the professionalism, I say.
Yeah, for sure. But in terms of finding us, you can reach out to, we have a website, radiantrecoverywellness.com. We're on Instagram. We're very active on Instagram. So easy for you to message us. And we do have a business line that's call or text, which is great because
Oh, I love that. Text is so key. So people can find you from your website. They can find you on Instagram, and they can text or call as well.
Yes.
I love that. So what if a nurse wants to join your team? Like, should they reach out to you the same way?
So yeah, you can either call our business line, then we give you our manager's email. We do interview videos, so people could send in, we send them a list of questions and they kind of have to send us so we can review it and then move on with
and based off the nurses' requirements, that's
Yeah.
we'll hire them. And something that we also wanted to touch upon that we forgot to say is one of the most rewarding parts about doing this. Not only are we helping so many patients and building such meaningful relationships, but we're helping nurses remember why they became nurses, right?
Yeah.
So they're so burnt out in the hospital and they are miserable and they forget why they became a nurse.
Yeah.
And when they come work for us, they are like, this is my favorite job in the whole entire world. And they become best friends with their patient and they build such a meaningful relationship, and the both of them will never forget each other. So that's probably one of the most rewarding parts about our job.
100%.
I love that. I actually have somebody who wants to work for you guys, so you'll be getting their information soon.
Send her over, yeah.
I love it. I love it. All right, ladies. Well, is there anything else that you want my audience and your audience to know, or any like pro tips, anything else that you can think of?
Pro tips. I would say just do your research before you get surgery, and research hard. And before you get a surgery, you want to think about it long and hard, which most people already do. Research your surgeon and research what your recovery is going to look like.
Yeah, be educated.
Be prepared.
Yeah.
And call Radiant Recovery and Wellness.
And call us. We'll be here for you.
Amazing. Well, it was so good talking with you guys, Deanna and Marissa. You guys are fabulous. I can't wait to hopefully have many, many patients utilize your services here in the Palm Beach area. Please give them a follow on Instagram at Radiant Recovery and Wellness, and go to their website. Is it radiantrecoveryandwellness.com?
Yeah.
Okay, perfect. Easy peasy. And if you haven't already, send me a DM, like, subscribe, do all the things with the podcast. I really appreciate you girls coming on today. Thank you so, so, so much.
It was so nice to meet you. We'll talk soon.
Sounds great. Have a great rest of your week.
You too.
Take care.
All right. Bye, everybody.